Coming up on The Code of Life.
This particular agent, I don't think anyone could have prepared for. The magnitude of the global response, the impact on the global economy has been huge. It behooves us to try to work together to come up with the kind of information we need to re-engage our economy, and genomics is a part of the tool that helps us do this.
Welcome to The Code of Life. This is a podcast about genomics and how genomics plays a role in the health of our planet, our people, and unfortunately right now, this pandemic. My name is Krajden Natalie, and I'm joined by two scientists, investigators really, who are helping to crack the code of the coronavirus. Dr. Mel Krajden and Dr. Natalie Prystajecky join me now. Welcome to both of you.
Welcome, Krajden.
Hello.
You both work at the BC CDC, and every week the Center for Disease Control has something called Grand Rounds. They're public, they're posted online, and you really kind of tackle research topics meant to encourage discussion and debate, a lot of groundbreaking topics. And I attended Grand Rounds on February 4th, where the topic was the 2019 nCoV novel coronavirus, something we'd only heard of for maybe a week. Canada had only had its 5th recorded case in that time. And since then, have either of you had a day off?
Sadly, I don't think we have.
The work continues daily.
Absolutely. So typically at the BC Center for Disease Control and as scientists and microbiologists, Dr. Krajden, you're an investigator on the first team in the world to help sequence the SARS virus genome. So I can imagine it's been a mad rush for everybody there. But when a deadly pandemic hits our world, one of the first things that scientists have to do really is figure out what it is. How did genomics play a role in that this time?
What was important for this particular illness was we were trying to track these cases of an unknown illness in December of 2019 in China. And then the World Health Organization reported this unknown agent on December 31st. And they were able to confirm that it was caused by a novel agent on January 2nd. And it took them about 8 days to release the whole genome. And Natalie will speak to this. The modern genomics allows you to identify a new agent without having any idea of what it looks like or any other details. And what our laboratory did was to recognize the potential for a pandemic or an epidemic to occur. And as soon as the sequences were released, we were working on trying to identify tests that could be applied, nucleic acid-based tests that could detect this agent. And that work, by 3 days later, January 13th, we were able to assemble what we thought could be a reasonable test that could be used and also scaled, so that because if you have a pandemic, you want to be able to have a scalable test. And on January 14th, the World Health Organization helped us by reporting a sequence that they thought would be a good region to detect the virus. And so we, together with Natalie and others, created a test that could detect this agent specifically, and ordered the necessary consumables, the reagents. These are the materials that go into making the test work. And within essentially a week, we were able to have a test and begin to validate that test to see that it works. And what's important for people to understand is all of this was done based on a reported sequence. There was no live virus to work with. It's all based on synthetic chemistry, essentially. And then we started to test people in British Columbia actually on January 23rd. And lo and behold, on January 27th, we had our first person under investigation that was diagnosed by this test. And then essentially by February 2nd, we had tested over 151 individuals.
Once the BC CDC helped develop a diagnostic test to be able to test people, I know that there wasn't a lot of testing kits available in Canada, in BC, even around the world. And I wanted to talk to Dr. Prystajecky why it was so important to really track the transmissions at that stage, to see what the genomic sequencing of the virus is. I heard the coronavirus described as fairly well behaved. So what does that mean, and how does tracking the transmission assist scientists to really crack the coronavirus?
So yes, you mentioned that the coronavirus is well behaved, and it doesn't mutate at a particularly high rate. Something like HIV or influenza, they can change quite quickly. They can either change quickly because of the virus behavior, the way that it replicates, or it might change quickly because it's maybe a virus that can be in two organisms that can cross the different organisms and undergo massive recombination, like we see with influenza, that produces a very different virus in the future. In this case, we don't expect a lot of recombination because of the nature of its genome structure. And we've also seen over the course of the outbreak, which at this point has been about 4 months, that it's accumulated about 10 to 12 mutations total. This isn't very many. And from this perspective, it means that we can't pinpoint to the same level of discrimination as maybe another pathogen, but it does allow enough discrimination for us to say that there are certain strains that are aligned with certain geographic regions. So in the very early days of this outbreak, we could sequence a genome and then relate it back to a person's travel history, and it related back quite well. And so we were able to see the first few cases, they had a travel history to Wuhan, China, and of course, those are the types of strains that we saw. Later on, we saw it to different regions in China, and again, that genomic data confirmed the epidemiological links that we knew. And then we started to see some sequences from Iran. And now we're at a point where we have closed our borders, and the majority of transmission is occurring within the community. And we can start to look at some of those transmission patterns, and we can start to look at outbreaks and to see if perhaps the outbreaks are linked to one another. It can be hypothesis generating, i.e. these two cases or this cluster of cases might be related to each other, or it can be hypothesis confirming. We know epidemiologically that there is this link, and then we can use that genetic data to confirm it. And it's going to be really important as this outbreak progresses, is that we are going to be taking away those public health countermeasures, the social distancing, the closing of certain types of facilities. And we want to be able to use this data in the future to understand, as we open up the floodgates, what transmission is the most impactful, and we could potentially use that information to change the measures that are in place to control the outbreak.
As of this recording, Canada has almost 2,300 deaths and more than 43,000 confirmed test positive cases. But that is considered that we are planking the curve, that Canadians are doing their job to help stop this virus. As you mentioned, Dr. Krajden, after you sequence the virus, after you find diagnostic testing for it, then comes the serology testing. Why is the serology testing so important, and what kind of role does genomics play in that?
So serology is very important because that's essentially measures typically antibodies, which are proteins that people create in their bodies that protect them from infections. And in order to make a serology test, you need to understand the target of the virus that you need to detect. And one of the challenges we face is this virus does cross-react with other coronaviruses, including potentially the SARS virus, the Middle Eastern respiratory syndrome virus, and other viruses. And the serology test, in order for you to understand the denominator of people who are infected, the test has to be specific. If it's misdetecting infections, as has already occurred, you can get a false quantification of whether or not you've been exposed. So you don't really understand the denominator, the number of people who've been infected in the population. And you may also, in some cases for other coronaviruses, there's evidence that if you're exposed to the virus, you make antibodies, and these antibodies protect you from reinfection. That's been shown for primates. It's been shown for other coronaviruses that affect humans. And the assumption is that if you've been infected by this coronavirus, the COVID-19, then you are likely to be protected at least from a short term. So the value of having serology is it helps you understand who has already been infected and who might be protected so that they're not likely to be reinfected. And for those jurisdictions where they've had massive infections, like in Ontario and in Quebec, more of the population has been infected. And for jurisdictions like ours, where we've controlled the transmission perhaps a little better, then we will need to know what proportion of our population has been infected, because as we relax the measures, we are more likely to have the risk of ongoing transmission, because in other jurisdictions that have been hit hard by the virus, more of the population are likely to be immune. So this is going to be very important for us to understand, and it's going to really help us determine what would be how much can we relax our measures, and also it can help us understand the transmission that has occurred not only in Canada but in other jurisdictions around the world, so you can learn from other jurisdictions about what works and what doesn't work in trying to prevent infections. And it's also important for us when we're trying to make vaccines against this virus to understand whether or not someone who had previous exposure to another coronavirus might do poorly with a vaccine that's not constructed properly, because it may actually make the outcome worse. So there's a lot of research to make sure that what we understand has occurred, and then to make sure that we understand enough about how this virus behaves so that we can make vaccines that are safe and effective.
Dr. Prystajecky, we're a long way from a vaccine, but as you mentioned, Dr. Krajden, in BC particularly, we're doing really well at planking the curve. A lot of British Columbians are getting a bit antsy to get outside and resume their normal lives again. What is the fine line for you as doctors at the BC Centre for Disease Control to start relaxing those rules? What has to be taken into account? What are you looking at as far as transmission rates, et cetera, to allow those restrictions or relaxations to occur to the restrictions, and what they might look like?
For that work, I mean, we really defer to Dr. Bonnie Henry. She's gathering the data from all the different health authorities and from all the different sources of data to really use that information to make those decisions, and really looking to other jurisdictions and how they're releasing their protective measures as well. I mean, we're in a situation where we still have double digits of the number of positive cases. We are still having outbreaks. Those outbreaks, as you may see in the media, they've been in long-term care facilities, in food production facilities, and I think that really is going to, as those outbreaks continue to occur, that may impact the ability to release those restrictions. And so I think that you'll hear in the daily updates that they're looking at what those relaxations may look like, but there's still a lot of data to be gathered. I mean, I think that we're here to talk about genomics, and one of the ways that genomics will really help us as those outbreaks continue to occur is to understand, how they're occurring and whether or not they're the result of continued community transmission, and what we can learn from that community transmission as to what the mitigation measures that need to be put in place to stop that transmission from occurring. And so, as we relax those measures as well, we can continue to survey the population, and as they continue to get tested, to understand where the transmission continues to occur. And the thing is that as those measures are relaxed, transmission will occur. When you have people in closer contact than they have been previously, the transmission can occur. And so I think we have to be very careful and mindful of the type of testing that needs to happen, and also when those measures will be relaxed.
I wanted to add that one of the important things to think about is in trying to flatten that curve, the intention was to try and minimize the amount of sick people who occupied the hospitals, and to prevent deaths in particularly with the elderly. And this virus is not a benign virus. It certainly is very nasty, particularly to old individuals. So in relaxing the measures, what you want to be very careful about is you're doing trade-offs. When people aren't employed because of the distancing, you're hurting your economy. And you really want to be able to make sure you can relax those measures without hurting and improve the economy, but at the same time make sure that you don't cause an excess of illness that requires hospitalization, intensive care, or death. And so part of it is to use the genomics to help you understand how you can better prevent transmissions within the community, and particularly in those populations that are very vulnerable.
And that kind of leads to the next question that I know, Dr. Prystajecky, you talked a little bit about during the grand rounds on February 4th, about the origin source of this virus. And I know that when I had been talking to you earlier, I mentioned that it's, the prevailing thought was that it did come from what's called a wet market, or a market in Wuhan, China. But now, because we know so much more, thanks to genomics, about the virus, that appears that possibly isn't the case.
Yeah, so the initial hypothesis was that a number of workers who had stalls at the Wuhan market, they became ill in the early days. And likewise, a number of the cases who were sick in the early days had close proximity physically to that market. And so the assumption was that there was something at that market that caused the outbreak to emerge. And this virus, it is a zoonotic virus, so it means that it spreads between humans and animals. And when they did the genetic sequencing of that very first genome, what was found is that its closest relative was not the original SARS-1, and it was not the types of coronaviruses that are circulating as respiratory infections in humans right now, like HKU1, but in fact, its closest relative was a bat that was collected in a nearby province in China a couple of years earlier. And that there was actually quite a small amount of genetic variation between that bat variant and the new SARS-CoV-2. And so it was assumed that there was something in that market that must have been an animal source that had a link back to bats that was the source of the outbreak. Now, as sequencing has progressed and we learn more about the rate of mutation of this virus, and some of the early reports of maybe illness occurring even before that time, it seems as though the hypothesis of it being the Wuhan market specifically might not be correct. And it certainly emerged in that area, and it probably had an animal origin, but was it the market that was the main source is still not to be determined. So there was environmental sampling of that market, and they did find some sort of coronavirus, but we haven't heard anything more about it. And perhaps it was just a red herring that it took us down the wrong path. And so there still will be continued work on the environmental side and on the animal side in terms of potentially finding a source. And, a lot of zoonotic viruses emerge without finding the original source. And so in the case of SARS-1, the one in 2002, 2003, they were able to link it back potentially to civet cats. And when they changed some of the behaviors with respect to, the consumption of civet cats or the breeding of civet cats, the outbreak did terminate in some ways, but we don't know, in fact, that was the main source. And that is the trouble with these zoonotic viruses, is that it's very difficult to track it down to what the original source was and what the early transmissions were. And there are a lot of efforts to create these global surveillance programs to understand the transmission of viruses between animals and humans. And one of such is a project called Predict that was going on for many, many years, trying to sort of survey the environment and the animals in the deep jungles to try to understand where the next pandemic virus may emerge from. So those are the kinds of efforts that are to start to really understand where transmissions occur. One thing that we do know for certain is that often we see the emergence of new viruses in places where there's an opportunity for humans and animals to mix closely. And this certainly occurs, for example, in something like a wet market. But at this point now, I don't think that is the final hypothesis for this virus.
This particular agent, I don't think anyone could have prepared for. The magnitude of the global response, the impact on the global economy has been huge. And I think it behooves us to try to work together to try and come up with the kind of information we need to re-engage our economies, do so carefully, and genomics is a part of the tool that helps us do this. And I think getting that information together, integrating that information, and using it to make sound public policy is what we need to do together.
And it has been incredibly remarkable, and you feel free to comment on this as well, about how quickly that first genomics sequencing was released by China and shared with the world. And now there's a global database, I believe, where every time it's sequenced, everybody can access it. That's pretty unprecedented, I think.
The first genomic sequence was released by China on January 10th, and that really led to rapid diagnostics to be able to be developed. And then the next phase was really that all the different countries, as they started to see the cases pop up, were sequencing in close to real time and releasing that data quite quickly. And what happened, that meant that we could start to understand how transmission was occurring globally at the time. People are releasing, there's over 4,000 publicly released genomes at this time. It's probably actually closer to 5,000 today. And there's sort of this precedent that as data is available, that it is released. And it's very remarkable. I think that if this had happened 10 years ago, we would not have seen the speed of this data release. And I think that it has become the norm, and it's required during a pandemic. The data needs to be shared widely and openly, but it's also the norm within genomics, particularly pathogen genomics, to release quickly for the rest of the community. And just as an example, we typically do this for salmonella sequencing. We sequence salmonella across Canada and share that data so that we can understand whether or not the disease is crossing borders. And it's just as important or even more important for this pathogen. And so I think the precedent has been set for data sharing and widespread sharing of data to be able to tackle this virus. And I think that this is going to have a lasting impact on genomics in society.
I was just going to add one important thing. In my career, when HIV was first detected, it took about 3 years to identify the virus. And then when you compare that to SARS, it probably took a few months to identify the virus, and you had to first grow it and then sequence it. And then when pandemic influenza occurred in 2009, you could literally detect a novel virus within days. And that essentially is the capacity that's occurred here. And that's so remarkable. And it's a tribute to the advances in biological sciences and technology. And that shows you that we're working in a modern age where information needs to be integrated quickly so we can respond better.
Final question for each of you. This is a podcast about genomics, but it's also a podcast, this episode, about COVID-19. So I wanted to end by asking you both, and Dr. Prystajecky, you can go first, is what keeps you up at night about this virus? And then what makes you finally fall asleep when thinking about it? Something comforting and possibly something worrying about it. I know that what makes me so happy to be a Canadian is that we listen to our scientists in this country, and we believe them, and that helps me go to sleep every night. So I'd like to know for each of you what your answers are. Natalie?
So what keeps me up at night is that there's just a lot of work to be done. The workload is high, and I wake up at 4 a.m. and I think about something I need to work on, and I think that that's just the nature of being working in this field, is that you have a lot on your mind. And so I wouldn't say that there's necessarily too much worry. It's more just the workload. What helps me sleep at night is that I feel proud to be here in British Columbia and to really see us flattening the curve and to see our responses, to see how well everyone's working together. I actually really like that this is science driven, that a lot of the response, that there's a lot of focus on the scientific response and being evidence driven. I think that is something that's very inspiring, and it makes you want to get up and go to work every day.
For me, what keeps me up at night is what I see in the day-to-day activities is the complexity of what we're trying to do. So it's not only about diagnosing people, it's really about understanding the spread of the virus. And it's about, and you mentioned that it's about the system listening to the scientists, but it's about the scientists being able to explain to policymakers and decision makers about what are the impacts of what science can bring to bear to helping us address this epidemic. And to me, that both keeps me up at night, and also I look forward to trying to figure out what is it we can do to help inform a sound public policy. And I think part of that is good and rapid diagnostics. It's about genomics that are applied to identify transmissions. It is about understanding who is affected so other scientists can develop effective vaccines or interventions, and putting all of this information together so that we can make sound public policy decisions.
Thank you, both of you.
Thank you.
Great, thank you.